one of the reasons I love doing the testifying so much is because it's a great responsibility. And I feel privileged being able to be in this role when I am in that role, advocating for either my client or an agency that I'm testifying on the behalf of, to make sure that everyone involved is being treated fairly, whether or not that is exactly what my client wants. Like, there are a lot of people I'm sure will, you're paying me, I'll be on your side of things.
Yeah.
But for me, it's you're paying me because I'm good at what I do, and I'm going to give you the honest, fair truth behind what my professional opinion, my clinical judgment tells me.
Yeah. Yeah. That's very commendable, I think. And try to stay true to that because there will be pressures, right?
Oh, there absolutely. And yeah, at the during my internship and postdoc, one of the things I did, if it wasn't working with sex offenders, we also worked with a local children and youth agency. So a lot of the work I did there, a lot of the assessments I did when it wasn't for juveniles for some sort of offense or criminal activity, it was doing assessments for the parents or on behalf of children and youth on the parents that had their kids taken away or were involved in some sort of abuse, whether they were the perpetrators or if they were the perpetrators by omission. It's like they didn't tell anyone that their partner was abusing.
Mm-hmm.
So in that, it was a lot of heavy work. And again, to underscore a lot of responsibility, because in my recommendations, I'm discussing if they are capable or have the skills at that given time to appropriately care for and parent their own child. And if not, what should visitation look like? If not, should there be any visitation? And then I would also do treatment for those individuals, providing summaries to be able to, all right, well, they've made this much progress now, so why don't we bump up some visitation, and making those recommendations to the court.
So that really underscores what you said earlier about the weight of what you're doing, that's a lot of responsibility
It
that
was,
here you are again as a young guy who's making decisions probably for people that are older than you are, right? About
yeah.
what they can and cannot do with their children.
Oh
That's
yeah.
ridiculous.
It was, and like something I've struggled with, and by something that's been brought up to me several times from when I first started in training. I mean, my program, I loved it, where our first year, second semester, we started seeing clients in the school's clinic. So very early on.
Mm-hmm.
And my first client I ever had, he was 50 some odd years old. I believe I was 22 or 23 at the time. He's like, I'm literally more than double your age. I have children older than you are. How are you supposed to help me?
Yeah.
And that hasn't stopped, especially in the work with children and youth. The first question, are you a parent? And I'm open with them, like, no, I'm not a parent. I can't tell you what it's like to be a parent. And most of the time, the clients are women, the mothers. And I'll throw in there, I'm also not a mother, and I will never be a mother. Gets them to laugh a little bit. And I explained to them, I'm not trying to tell you what it's like to be a parent. I don't know what your life is like, but I can tell you how to get your kid to do the behaviors that you want them to do in an appropriate way. I can give you the skills to relax and to cope with the stressors that are inherent in being a parent, the frustrations that come along when your kid doesn't listen to you, the frustrations of being in a low socioeconomic area. All of those, there's no guidebook. I'm the closest thing that you're going to get to a manual, and trying to get them to buy into what we're doing together in that way.
Yeah. You said I'm the closest you're going to get to being a what?
The closest that they're going to have to like a manual of how to
A
parent.
manual. Okay. Yeah.
Yeah, like there are books out there, but there's a book that will, if for one book that says this, there's another book that says that.
Yeah.
I spent 5 years in grad school, part of which was learning how to help get kids to listen and to teach appropriate behaviors and convey things in certain ways that not just the parents will understand, but children will understand. Um,
It sounds like you got pretty good preparation and that you have a lot of confidence around the preparation that you got in school.
yeah, I'm very fortunate for my program. It was a generalist model, which I really appreciated. They didn't try to pigeonhole you into you have to do CBT, you have to be psychodynamic or this or that. They really let us find our own path. And there was a professor that, matched whatever that was, whatever your orientation was. There was someone that you could talk to and consult with and get supervision from.
Wow, that's great.